So good evening all of you. Madhusudan, Mohammed, Srinivas and Dhananjay M and others. आप सबको मेरा प्रणाम. So welcome to the fourth session of Farre, that is medical jurisprudence. So in this session, we are discussing the most expected university question from legal procedure and medical law and ethics. Yes, Priyanka. Yes, Priyanka and others. Audio, video, is it clear? Is it clear? So, legal procedure and medical law ethics. So, in legal procedure, some important questions are basically the inquest. What is inquest? Types of inquest. Summons, types of summons. 3 marks question. Then comes is duties of doctor in witness box. Very important main question. Courtroom procedure. The steps of courtroom procedure. Then in medical ethics, the very important question is the principles of bioethics, medical negligence, recips or loquitur, defenses in case of medical negligence. All these are important questions. Let's discuss some 5 or 6 most important questions in the beginning. Later, we'll have discussion about some other important image-based questions. Yes, Smaranya Hati, are you there? Smaranya? And Smaranya, yes, Chandana D, Ruday, Dr. Chaudhary, Menaka Datta. Yes, good evening all. So good evening all. Let's start. So the first important question, define medical negligence. What is medical negligence? Mention 4D elements. Differences between civil negligence and criminal negligence. Usually 5 marks question. So it is divided into 1 plus 2 plus 2 like this. Medical negligence, very, very important question. Okay. Yeah. So one very common case we encounter in clinical practice, that is medical negligence. That is about the compensation. So usually the patient goes to a criminal court or the civil court. So he will ask for the compensation. So you must know what is medical negligence. So definition from standard textbook. Case and Reddy, you need to write like this. Definition: absence of reasonable care and skill or willful negligence of a medical practitioner in the treatment of patient which causes bodily pain or the infirmity, injury or infirmity, or death of the patient. Death of the patient. Okay, so this word should be there in the exam, this definition. Absence of, not the presence of. Absence of reasonable care and the skill. Very important. Like example, a case of dog bite. A case of a street dog bite, when history is there. So what would be the reasonable care in that case? Can anyone answer? Dog bites are very common. Street dog bite, now common, very common. As you know, there is one common risk is basically rabies. Rabies has 100% case fatality and it is vaccine preventable disease. So what is that? Yes, Madhusudan. Yes, very good. The first thing, the washing of the wound. Second, you can give antibiotics. And the third, the very important is anti-rabies vaccine. So we call it as ARV. ARV. That is 0, 3, 7, 14 and 28. So there are 5 doses, as you know. So that is the reasonable care you must know. Then one more example, case of burn injury. Again, burn injuries are very common, especially flame burn injury or scald. As a doctor, what is the reasonable skill you must have in case of burn injury? Can anyone tell me? Burn injury? Yes, Dr. Chaudhary. Smaranya Hatti is telling, sir, RL fluid. Very good. He's telling, sir, RL. Ringer lactate. So basically, the common complication is hypovolemic shock. So to prevent death from hypovolemic shock, you must infuse RL, ringer lactate, as per Parkland formula. As per Parkland formula, by using your knowledge of rule of 9. So that is a reasonable care and skill. Okay. So of a medical practitioner in the treatment of the patient which causes bodily injury. So bodily injury. So sometimes what happens? So there can be a mistake from the doctor, especially in case of operation by a surgeon. So that is leaving swab or instrument in the abdomen, which is known as res ipsa loquitur. So that is also can be medical negligence, right? Like example, leaving swab in abdomen. Okay. Or sometime when surgery is done on wrong side. So the patient came with a history of some lesion on the right side and he got operated on the left side. Wrong patient, sometime wrong patient, wrong side. So all these are basically examples for negligence. So this is the definition you must write. I hope you understood. So Muhammad Ansari and others. Definition, is it clear? So in exam you must write some important example as well. Then comes his 4D elements. So what are 4D elements? So 4D elements are basically, so D for duty. So D for duty. So when there is a duty of care established between doctor and patient, that is known as duty. Okay. Second, dereliction of duty. Dereliction means negligence of the duty. So when doctor is not doing his proper duty, or act of commission or act of omission while treating the patient, that is basically dereliction of duty. Third, so because of dereliction, so there can be direct causation. Direct causation. So when doctor negligence leading to death of the patient directly, like example, not giving ARV, so leading to development of rabies and death. So definitely there is a mistake or negligence from the treating doctor. So one example, okay. Then so there can be damage. So there can be damage as well. Not damages, it is damage. So duty, dereliction of duty, direct causation and damage. So all of you write in the chat box. Srinivas and others, keep writing. Okay. Now in exam, you must also mention about burden of proof. Burden of proof. Who has to prove the crime or who has to prove the negligence? Very important question in Viva as well. So burden of proof in civil negligence and criminal negligence. In civil negligence, the burden of proof lies on the patient. So patient has to prove that the doctor is negligent. So that is in civil negligence. Criminal negligence, doctor has to prove that he is innocent. So very important. In criminal negligence, doctor has to prove that he is innocent. The opposite party is the state. In civil negligence, the patient has to prove and the opposite party is the doctor. Okay, so this is also very important. Then comes is the types. So what are types of negligence? Yes, what are types of negligence? What are types of negligence? Can anyone answer? Types of negligence. So Ruday and others. What are types of negligence? Types of negligence can be a doctor's negligence. So that is basically civil and criminal negligence. Corporate negligence. Contributory negligence. Right? So there are many types. So one is the civil negligence. Civil negligence. Second one, criminal negligence. Third, corporate. The fourth, patient negligence. So it is given in some book, so not in the KSN Reddy, some other textbook. Patient negligence. When patient is negligent, okay, so that is known as patient negligent. So when there is a negligence, when there is a bodily injury because of patient negligence, so that is either it can be lama or dama. Lama dama. Example, lama dama. So lama means left against medical advice. Dama means discharge against medical advice. So these two are basically example for patient negligence. Sometimes it can be contributory negligence. Contributory negligence. Okay, so this is very, very important. Corporate, all this. One example you must write in exam. So civil negligence basically known as minor type of negligence. We call it as non-gross negligence. So minor negligence. Minor. Not severe. Not the gross. Anything other than the gross negligence is the minor negligence. That is civil negligence. Criminal negligence, very gross negligence. Very gross negligence. Like example, wrong patient. The surgery on wrong side. Leaving swab or instrument in the abdomen. Transfusion of the blood transfusion leading to death of the patient. Wrong blood transfusion. So all these are basically gross negligence leading to death of the patient. So that is about the criminal. So corporate, when entire hospital is at mistake. When entire hospital is at medical negligence, like example, hospital owner, the medical superintendent, the treating doctor, anesthetist, surgeon, everyone is responsible. Then it is known as corporate negligence. Okay. Then comes is your patient negligence. I said about lama and dama. Then contributory, when it is doctor and patient, both are negligent. So patient plus doctor. So when both are negligent, when both they contribute, leading to bodily injury to the patient or death of the patient, then we call it as contributory negligence. Okay. So all of you write in the chat box, patient negligence is equal to lama dama. Patient is equal to, right, lama dama. Lama dama. Okay. Write this in chat box. Okay. Then again, in the exam you need to write about differences between civil negligence and criminal negligence, along with some examples. Okay. And criminal negligence, it was punishable under section 106. So all of you concentrate here. Now, as per recent amendment in the 106 BNS, so medical negligence is no more criminal offense. It's more of civil negligence. It's more of the matter of compensation. So 106 now, the doctors are by doctor negligence. or the medical practitioner's negligence is not included in 106. Previously it was there in 106. The punishment was up to 2 years of imprisonment. Now it is not there. Okay, Sutapa Samanta. Sutapa Lama means Lama. Left against medical advice. Lama means left against medical advice. The patient left without informing you, without informing the doctor. He just left from the hospital. Then something goes wrong, then he is responsible, not you. That is known as Lama. The same thing that is Dama as well. Discharge against medical advice. Okay, that is also a very common practice. So when patient is not willing to have proper treatment, so then he can just write, you can take the signature from him. So that is known as Dama. Discharge against medical advice. Lama and Dama. Okay, yeah, Sutapa Samanta, that's great. So, yes, after the class, okay. Now look at this. This is a case of dog bite, discussed already. And one of the common disease, very common in India, that is rabies infection. So rabies infection. So rabies infection, remember, it has 100% case fatality. All I write in the chat box. Rabies is equal to 100% case fatality rate. So write this in chat box. So as a doctor, as a RMP, you must know how to treat. That is basically ARV, anti-rabies vaccine. So that is given at free of cost. So in all government hospital. Okay, good. So only one disease which has 100% case fatality in general, that is rabies. Ebola is around 90%. That's okay. Chalo. Now look at this, one more example for reasonable care and skill. The patient came with a history of urinary retention. What we can see here, distended bladder here because of some obstruction which is there in the patient. Now you let me know what is the basic duty of doctor in this case. Come on, what is the basic duty? The patient came with a history of urinary obstruction since 1 or 2 days. So on examination, what we can see here, distended bladder, that distended the suprapubic region. So what happens? So when there is a more and more urinary retention, there can be a bladder rupture. So there can be release of urine into the pelvic cavity. So it can lead to peritonitis and other complications and death. So what is your duty in this case of urinary retention? Yes, very good. So Priyanka is telling, sir, catheterization. Very good. So the treatment is catheterization. So as an MBBS doctor, as an intern, as a registered medical practitioner, you must know how to do catheterization and to give emergency treatment. Okay, that is about the reasonable care and skill. Yes. So should administer Foley's catheter after consent. Yes, good. Medico is answering. That's great. Good. That's okay. That's fine. Now look at this. This is one more case of medical negligence. So the patient had undergone some abdominal surgery. So probably appendicitis or probably some pelvic surgery. So after a few days, patient came with a history of fever and pain over the abdomen. Then X-ray was taken. On X-ray, what you can see here, there is one very important finding. There is an instrument inside the abdomen which is left behind by the surgeon. My question, what is this known as and what is this type of negligence known as? Is it civil negligence, criminal negligence, or contributory negligence, or corporate negligence, or it is patient negligence? Jaldi batao. Come on guys. So this is classical case of res ipsa loquitur. Res ipsa loquitur, it is a Latin word. The meaning of that is the fact speaks for themselves. The fact speaks for themselves. Like example, instrument in the abdomen, that speaks for the doctor's negligence or surgeon's negligence. Okay, so it can be a case of corporate negligence. Yes, corporate negligence. Basically, it is a doctor's negligence. The patient can sue entire hospital as well, corporate negligence, as well as civil negligence, criminal negligence, right? It is not contributory. Okay, so it's basically corporate negligence. So that's great. So, and remember, this res ipsa loquitur can be 3 marks question. So when it is asked as a 3 marks question, you must answer like this. Res ipsa loquitur is a fact speaks for themselves. Like example, instrument in the abdomen. It is applicable for both civil and criminal negligence. Here, doctor is negligent. Doctor has to prove that he is innocent by giving proper evidence. Okay. So most of the time it will go against the doctor and against the surgeon. Good. That's great. Anish. This is one important table. So this I'll give you after the class. Just go through this. Differences between civil negligence and criminal negligence. Civil negligence, simple absence of care and skill. Here it is gross carelessness. Very gross carelessness. So all this you just go through after the class. Now all of you identify what type of negligence is this. Look at the newspaper headline. Doctors accidentally amputate the wrong leg on elderly patient in tragic mistake. So wrong limb amputation. Yes, come on guys, try to answer. Yes, good. Mohammed is telling, sir, doctrine of common knowledge. Very good. So here it is doctrine of common knowledge. Okay. So it is basically very gross negligence. Very gross negligence. Okay. No, it can't be therapeutic misadventure. No, medico, it is not therapeutic misadventure. Therapeutic misadventure. Now here what we can say here, wrong leg. So wrong leg, that is the operation done on right side instead of left side. So this is basically gross negligence, usually criminal negligence we call it as. Now one more example here, mismatch of blood transfusion. Mismatched blood transfusion. So there can be AVO incompatibility and death of the patient. So anaphylaxis. So my question is, so what type of negligence is this? Is this gross negligence or it is civil negligence? Just answer. Just try to answer. Yes, it is basically criminal negligence. Now, one more here, one more example. Just go through this and try to answer. Doctor applies tight plaster. So as you know, the plaster should be applied properly. Applying very tight plaster can lead to contractures, can lead to paralysis of the limb. So here doctor is negligent. But instruct him to report numbness. If any numbness is there, you just inform me. That is what instructed by the doctor. Patient developed numbness in his toes does not inform doctor. It is a patient duty to inform the doctor, but he does not inform the doctor, suffers permanent injury, suffers some permanent limb contracture or paralysis of the limb. My question is, what type of negligence is this? Yes, come on guys. Come on, try. Yes, this is example for contributory negligence. So this is contributory negligence. That's okay. Chalo. Good. So this completes your one important topic, that is basically medical negligence. Okay. Yes, is it clear guys? Is it clear? Smaranya, what is your doubt? Yeah, both are same. Gross negligence and criminal negligence. So both are same in general. So gross means criminal. So minor or simple, that is basically civil negligence. So that is what given in standard textbook, and that is the standard practice we do. Yeah. Yes. Lama and Dama. That's okay. Chalo. Now we are going to discuss about one very important topic, very commonly asked in Viva, very commonly asked in your university exam as a 3 marks question, or sometime 5 marks question as well. Can anyone guess what is the next topic? And can just identify? Arjun Reddy, Hannah Srinivas is telling. Arjun Reddy, Dhananjay M is also telling yes sir. So have you seen this movie? Very nice movie, old movie. So Telugu movie basically. So in that movie you must be knowing he must be a surgeon, an orthopedic surgeon. So he will do so many things, so many things, being a doctor, being a medical student, and being a clinician. Arjun Reddy movie. Can anyone tell me what is the next topic? So next topic, so your guess is correct. So the answer is infamous conduct. Very commonly asked 3 marks question and 5 marks question. Explain about infamous conduct. What is infamous conduct? Infamous. In simple word, so doctor can become famous, not in good way, in bad manner. Say we can say bad doctor, not a good doctor, bad doctor. So explain about infamous conduct and give examples, and what is the punishment for that? Usually 3 marks question. Right, good. 6D disco, that's great. Okay. So in general, you need to write like this. Disgraceful, disgraceful, dishonorable. See, medical profession is a serious profession. The people consider doctor as next to God. We are next to God, right? So dishonorable behavior, disgraceful behavior, unethical behavior, we are bound to some moral principles. So when doctor is doing some unethical behavior, dishonorable, disgraceful behavior, as judged by professional men of good repute and competence. So it is decided by, are judged by doctors themselves, not by the judge or not by the some other person. It is judged by the doctors. So that is known as professional misconduct, or we call it as infamous conduct in general. Okay. Good. Yes, Jay and others. Good. That's great. All answering. That's great. So the very simple old mnemonic 6A. 6 A's starts with the A, most of them. A for association with unqualified persons, which is known as covering. So all of you write in the chat box, association is equal to covering. Please write in chat box. It's very important MCQ as well. So when doctor is involved with some unqualified person, like example, allowing some non-medical person during clinical examination or during surgery, then it is known as covering. So the doctor has to maintain 100% confidentiality. So when he's allowing someone, unqualified person, in treatment room or in surgery room or in delivery room or during clinical examination, then it is known as covering. It is definitely an example for infamous conduct. Yes, good. Then second one is dichotomy. Dichotomy means taking commission or giving commission. Taking commission, giving commission. Like example, you collecting some 1,000 rupees. So you're just collecting some 1,000 rupees. Okay. And giving some 200 rupees to the some the middleman. So and asking them to bring some more patients. Okay, you bring 10 more patients, tomorrow I'll give you some 2,000 rupees, like that. So dichotomy means taking commission or giving commission or taking commission from the pharmacy, taking commission from the fellow doctors. So for referral. So that is basically known as dichotomy, which is known as fee splitting. Okay, like example, 1K is divided into 800 and 200 as a commission to the middleman. So this is how you can write in the exam. Okay, cut practice. Yeah, so Meena Datta is telling, sir, cut practice basically known as professional misconduct. That's great. That's great answer. Good. Then advertisement. Advertisement using large signboard. Like example, Dr. Manjunatha, FMT Guru, like that, using large signboard everywhere, the entire city. So doing some unusual advertisement. So that is all basically infamous conduct. You can advertise when you are opening hospital or when you are changing the address, when you are closing the hospital, when you are starting some new service, then we can do advertisement. So there are some rules are there for that. So, but using large signboard, just like 100% surety of treatment, 1+1 offer, 5+2 offer. So that is basically advertisement. So that is infamous conduct. With pictures. Smarana is telling with picture. So picture of the patient, so and so, like that. Okay, good. Should not publish any certificates. Yeah, should not publish any certificate. That's also great. Arjun Reddy, that's okay. Then adultery. Again, the Viva question can be asked. When doctor can do advertisement? Your answer must be, sir, when opening the hospital, or changing the address, or starting some new treatment, starting some new device, or closing the hospital, you can do press conference or you can do some advertisement as per the rule given by the NMC. So there's an NMC book, NMC guidelines are there. So as per that you can do. Adultery, basically adultery means having sexual intercourse with the patient. Okay, so that is basically adultery. Adultery, like sending Instagram message to the patient, sending Facebook message to the patient, hi, how are you, where are you, like that. So that is actually comes under sexual harassment as well as adultery as well. So there are various definitions for that. Okay, good. Chalo. Is it good way in messaging patient, hi, how are you, in Instagram, Facebook? What do you think, guys? Is it good conduct or is it a very bad conduct? Sending messages to the patient, especially female patient. Okay. So doing some personal conversation, is it a good conduct or bad conduct? As a doctor, as a reputed doctor, what do you think? Dhananjay? Yes, it's bad conduct. So better you can avoid. Sometimes what happens, they do message you in Instagram and Facebook. You just tell them, so don't message me, or you can just directly come and meet me in the hospital hours. So sending messages sending messages through WhatsApp, Instagram, so like that you can just block them. So that's the best way as per my knowledge. So abortion, then abortion without any indication. So as you know, abortion, there are various indications: therapeutic, eugenic, humanitarian, social indication, like that. So when doing abortion only for the purpose of female feticide and as per PCPNDT, sex determination, so then it is unethical practice, then it is basically infamous conduct. It is punishable under PCPNDT, and it is a non-bailable offense, cognizable offense at the same time. So he will get warning from the State Medical Council. Addiction, like example, heroin. So treating the patient under the influence of heroin, taking heroin every day, and treating the patient under the influence of heroin. Ganja. So what is ganja? Cannabis. So and alcohol. So alcohol as well. So all these are basically 6 A's of infamous conduct. Okay. Now I have one interesting question, all of you. So is alcohol is completely offense? Having alcohol by the doctor, is it really offense? Can doctor have alcohol? Not during treatment, after his duty is over, or in some parties, birthday parties, or doctors parties. Can he legally can he have alcohol and enjoy his life? What do you think? Yes, very good. Muhammad is answering, sir. Duty hours is an offense. So morning taking alcohol, beer, and treating the patient like Arjun Reddy. So and doing surgery under the influence of alcohol, then it is offense. So, but in general, after duty hours, you can do whatever you want. So you are doctor by profession, but at the same time, you are also human being. You can do whatever you want after duty hours. That is what I am just telling you. No, don't worry. So then punishment. What is the punishment? The punishment usually given by SMC. So this is again MCQ. SMC means State Medical Council. So in any case of professional misconduct, so the punishment given by State Medical Council, like example, Karnataka Medical Council, KMC, Tamil Nadu Medical Council, TMC, Delhi Medical Council, DMC, like that. Without NMC, it is basically State Medical Council. Usually punishment can be warning, it can be a temporary suspension of the practice, for some time, maybe 1 month, 3 months, more than 3 months, 6 months, like that. Again, there are grades are there, so you can write the grades as well. Are permanent removal of name of the doctor from the medical register. That is known as professional death sentence. So this is again very commonly asked question. What is professional death sentence? Removal of name of the doctor from the medical register, usually by State Medical Council. That is known as PDS. PDS. Fine also. Sometime it can be fine as well. Okay. So this is about the 3 marks question, and 5 marks question. This is more than sufficient. So I'll repeat again. Infamous conduct is known as professional misconduct. It's a dishonorable, disgraceful conduct of the doctor, judged by the professional men of good repute and competence. 6 is association, advertising, adultery, abortion, addiction, and alcohol. The punishment given by SMC, either it can be fine, warning, or it can be a temporary suspension of the clinical practice, or permanent removal of the name of the doctor. That is known as professional death sentence. I hope it is clear. I hope it's clear. Guys, say yes or no? Yes or no? Sanjana, Lokesh and others? Clear. Sure. Now you need to answer. Look at this. Now you just tell me, is this infamous conduct or not? Just say yes or no. And here is the doctor. Say example, Dr. X. So his name is Dr. X. And the patient is here. Dr. X is telling, oh no, I never thought of Dr. Sahani is so poor in surgery. Dr. Sahani is so poor in surgery, your hand has not recovered even 5% of the surgery. Not even 5%. So, telling like this in front of the patient about some colleague, some other doctor, is it infamous conduct or not? Yes, so this is basically infamous conduct, as well as it is against medical etiquette. So there are some problems between two doctors, two clinicians. So, but that should be very personal. You should not tell anything wrong about the doctor in front of the patient, because we are bound to rules of medical etiquette. Yes, okay. Medical etiquette. Then one more example. Look at this. This is one more. You just identify what is this A basically. 6 A's we discussed. Now, what is this A? So here is our Arjun Reddy. We have Arjun here and we have patient. So Arjun Reddy, our doctor is telling, Miss, now will you please lift your t-shirt? I have to examine you thoroughly. Then patient is telling, but doctor, it's my left knee I hurt while playing. My question, what is that A that is in relation with this clinical scenario? Yes, very good. Is it adultery? Okay, so this can be an adultery, right? Adultery. And one more thing, remember, while examining female patient, there must be one female attendant or nurse. Okay, remember this. So male doctor, when examining female patient, he must examine in presence of nurse, female nurse, not the male nurse, or female attendant or relative. That is must. That is a rule. Right to remember. Okay. And one more thing. So in general, doctors, what they do, they fix some CCTV in their hospital just to prevent the misuse of the law. So that is also happening in some cases I have seen. So just to prevent misuse, CCTV is must, and always examine female patient in presence of female nurse or female attendant. Female attendant. Yes, great. That's okay. Then I have one more scenario. Now look at this. One more infamous conduct. A doctor here and a patient relative. And doctor is telling, though I have told him this is a simple surgery, I must tell it's major surgery. So doctor is disclosing after surgery, not before surgery. So in the beginning he said simple surgery, and later he's telling it's major surgery and all. Now my question is doctor at fault or not? If so, what is wrong in this case? What is wrong in this case? Yes, good. So this is basically rule of informed consent. Or rule of full disclosure. Again, there are exceptions are there, but in general, as a rule, you must disclose everything about the surgery, whether it's a major surgery, minor surgery, what is the diagnosis, what is the prognosis, what are the common complications, and all you must explain to the patient. This is known as rule of informed consent or rule of full disclosure. Okay, informed consent. So getting my point, I think. Right. Then I have one more example. Now look at this. Now again, you just find out what is the wrong in this scenario. Find it out. Okay, so you consent to undergo blood test. So here, look at the patient, smiley patient, smiling at you. So you consent to undergo blood test. Then also I am doing other tests also, like echo, ECG, everything I will do. What type of consent is this known as? Okay, taking some consent form in the entry, during the entry to the hospital, and doing all investigations. What is this consent known as? Is it legally valid or invalid basically? Yeah, Mohammed Ansari, yes, I said there are some exceptions. Therapeutic privilege is exception, I said. Therapeutic privilege are some, in some cases of therapeutic waiver and all, it is exception, but in general, so that is a full disclosure. So this is known as, not extended consent basically, so this is known as blanket consent. Blanket. So basically, you must explain everything. So you must take the consent for all the tests. So not only the blood test, ECG, echo, and other tests as well. So that is blanket consent. So that is legally invalid. And the last one, very interesting one. You need to identify. There are two doctors are there, Doctor 1 and Doctor 2. Doctor 1 and Doctor 2. So thank you, doctor. Thank you. You will get 30% per case. 30% per case. This is a promise. Do continue. My question, what is this known as? What is this known as? Madhusudan and others. This is known as dichotomy. Good. So the next question, the very important question is from the inquest. As you know, inquest means inquiry towards the cause of death. Usually in case of unnatural death, not in the natural death, in case of unnatural death. Like example, suicide, homicide, exhumation, skeletal remains, death in psychiatric hospital, death in lockup death, death in jail. So any unnatural death, we are going to do inquest. The question very commonly asked, types of inquest. So have you seen this movie? Very famous movie. So where investigating officer is the higher higher officer basically, and very interesting movie. I think it is recently dubbed in Hindi as well. So very nice movie, one of my favorite movie during my UG days. I know. So what is this movie? Can anyone identify? Come on guys, come on. Some fun is needed in between the class as well. Come on guys. Yes. So Mena Datta, blanket consent means like it's a general consent taken at the entry at the entry of the hospital for all the procedures. General consent for all the procedures, all the investigations, and all the treatment. That is blanket consent. So taking signature on general form, that is blanket consent. That is not legally valid. Yeah. Good. What is this movie? किसी को पता होगा? So types of inquest. So one is the police inquest. Second one, magistrate. Third one, coroner. Medical examiner. Medical examiner. And procurator, fiscal system. So there are basically 5 types. If you mention all 5 types, examiner will be very happy. So in India, we have only 2, police inquest and magistrate inquest. So police inquest by, that is 194 BNSS. Magistrate is 196 BNSS. So in India, we have only 2. The best is the magistrate. The most common one is the police inquest. So coroner, so it was there in India in Kolkata and Mumbai. So now it is not there. So now it is abolished. So medical examiner, that is prevalent in US, one of the best inquest system. And procurator fiscal system, that is there in Scotland. So medical examiner in US. So magistrate is the best. The police is the common one. So all of you write in the chat box. Police is equal to 194. Magistrate is equal to 196. Keep writing this. Keep writing this. Theory, yeah, the movie name is Theory. That's great. Then again, what are the indications for magistrate inquest? So magistrate means either it can be judicial magistrate or in general executive magistrate, like example Tahsildar. The conditions are basically magistrate inquest, that is done in case of death in prison or police custody. We call it as lock-up death, right? Death during police firing. When police is involved, then inquest should be conducted by magistrate. Exhumation. Exhumation basically for second autopsy or in any case of buried body. So exhumation, that is digging out the dead body from the grave, that is known as exhumation. For exhumation, we need magistrate inquest. Enquiry should be conducted by the Tahsildar or AC or DC, not by the police officer. Death in psychiatric hospital, like example schizophrenia patient. Very common, schizophrenia, depression, common cause of suicide, common cause of mortality in psychiatric hospital. So death in psychiatric hospital, again it is a magistrate inquest. Then very important is dowry death. Death of wife within 7 years of marriage in unnatural condition, like example burn injury, like example hanging, that is known as dowry death, basically 80 BNS. So this is very, very important. Yes guys, this is very, very important question. You must know. आपको पता होना चाहिए. Commonly asked. So बार बार पूछते हैं. ठीक है? 80 BNS, yeah, dowry death. That's great. So this is about the inquest. The next question is very commonly asked is, what are the components of recording evidence in court of law? So what are the components in general in court of law? Or sometimes question can be asked, what are duties of doctor in witness box? So you can mention what are general duties, or before entering the witness box, what are your duties? What are duties within the witness box? And what are your duties after the witness recording? So all this also can be asked as a main question. That is a simple one. It's basically a theoretical topic we discussed many times in legal procedure. You can just go through that. So here is, what are the components of recording evidence in court of law? Yes, mention decorum. Smaranya, what is your doubt? Yeah, best is medical examiner. Yeah, now it is not there. Smaranya, it is now the doctor's negligence is not included in 106 BNS. So as per the amendment, now it is not under 106. Only it is civil negligence. It is no more criminal negligence as per the new rule. Yes, Smaranya. Okay, that's great. That's fine. Chalo. What are components? Can anyone tell me what are the components of recording evidence in court of law? Come on, guys. So before that, so let's identify one important character in recording evidence. Can identify the important character in recording evidence? I've seen this movie, LLB 1 and 2. So one of the finest actor. So remember, judge is the main character. Okay, you are on a judge. Okay, right. So now look at this image. We try to identify these three important personalities in any courtroom procedure. Identify. Okay. Smaranya and others. Who is he? Who is he? Come on. Yeah. So judge. Okay. Public prosecutor. PP. Public prosecutor. Government lawyer. Defense lawyer. Defense advocate. Okay. So three important personalities. So in general, the courtroom procedure starts with the oath. So there are 5 steps. The first one is the oath. Second, examination in chief. Examination chief. Cross-examination. Re-examination. Questions by the judge. So generally there are 5 steps. Questions by the judge. Now, here are some important MCQs as well. As you know, oath is mandatory. So oath is mandatory in courtroom proceedings. So not taking oath is also punishable offense. My question, oath is not required. The oath is not required in. Can anyone tell me? The oath is not required in some persons. What is that exception? Yes, SJ and others. Yes, very good, Srinivas. Less than 12 years. So oath is not required in less than 12 years of age. And one more important 3 marks question, perjury. Perjury. So perjury means telling lie, willfully giving false evidence under oath. Willfully giving false evidence under oath is known as perjury. It is punishable under 227 and 229. So basically BNS are 227 and 229 BNS. So all of you write in the chat box. The BNS sections related to perjury are, one is 227, that is the definition of perjury, that is willfully giving false evidence under oath in court of law. Punishable under 229, the punishment can be 7 years of imprisonment. So telling lie in hospital, okay, but telling lie in court, the punishment can be 7 years of imprisonment. So be very careful. So giving false evidence, giving false certificate, so can be punishable under various sections of BNS like 234 BNS, 229 BNS. Okay, very, very important. Then very important is examination chief. Examination chief, leading questions are not allowed. So as per the rule book, leading questions, yes or no type of questions, are not allowed in examination chief. There is again one exception. Can anyone tell me what is the exception for asking leading questions in examination in chief? Try. What is that exception basically? You can ask leading question, yes or no type of question. His length of knife is 10 centimeter. Is the murderer is Ram or Sham? Like leading questions you can ask, or a defense lawyer, so or the public prosecutor can ask basically. So in what that condition? So very good. So Dr. Chaudhary said, sir, hostile witness. So in case of hostile witness, in case of U-turn witness, when witness is changing his statement during courtroom proceeding, then public prosecutor can ask leading questions. This is one very important viva question. So then comes is your cross-examination. Cross-examination. Remember, cross-examination conducted by the defense advocate. There is no time limit. It is to find out the inaccuracy in the statement of the witness. So no time limit. So cross, no time limit. Write this in chat box. So it can be 1 day, it can be 2 day, 3 day, like that. So cross examination, there is no time limit. So they can ask relevant questions. So till the court is satisfied about all the doubts, all the inaccuracies or accuracies in the statement of the witness. Remember this. So cross, no time limit. So cross examination, leading questions are allowed. Leading questions are allowed. Leading question means yes or no type of questions. Good. So this is about the then comes is re-examination. So re-examination again conducted by the public prosecutor to to give the answer for the any doubts that is taken place during cross-examination. And lastly, questions by the judge. So judge can ask question at any time during procedure. So this is also again a viva question. Again, it is a very important MCQ as well. Okay. Yes, public prosecutor. Again, leading questions are not allowed. New topics are not allowed. So there are 5 steps are there. There are 5 steps. Okay. So all of you guys have understood about these 5 steps. So Ruday and others. Madhusudan? Yes. Soumyadeep Sarkar? Yes. Great. So Soumyadeep, how is your preparation? Soumyadeep, when is your exam? So when is your exam? When is your professional 3rd year exam? 3rd MBBS forensic medicine community medicine exam? Like Dhananjay, when is your exam? Menaka Datta. Acha, it's going on. Oh, November 24th. November 24th, right? Main exam. So final on December 1st. Okay. So anyway, time is there for you. Yes, Smaranya Hatti, when is your exam? Smaranya, are you there? Smaranya, Ruday, Dr. Chaudhary, Mohammad Ansari. Mohammad Ansari. Okay. So some more important question, all of you guys. So one very commonly asked, duties of doctor in witness box. So बार बार पूछते हैं. So duties of doctor in witness box. Then medical evidence. So after the class, just go through this most expected question. So medical evidence classification, medical certificate, medico-legal documents, dying declaration and all. Very important. Types of witness, expert witness and common witness, 3 marks question. Summons, three marks. Conduct money, 3 marks. What is conduct money and all, commonly asked. Dying declaration, so very important. And differences between dying declaration and dying deposition. And lastly, sometime they can ask you about what is BNS, what is BNSS and what is BSA also. Okay. ठीक है RO 75, you don't worry. Okay. Okay, that's okay. All is an important question. Chalo. So now the most important session and very interesting session, that is basically forensic spotters or some image based questions. So all of you guys, are you there? So Dr. Chaudhary and others ready for the next session, that is forensic spotters, as usual, as you know. So you need to answer in the comment section and let's decide, so like who's the winner and who is the one who answered first, like that. So yeah, ready, Ruday and others? So how is the Josh, my dear student? Somirip, Maneka Datta, Priyanka, your Josh should be very high all the time in forensic class. Okay. Chalo. Now let's start forensic spotters. So this is a question from mechanical injury. Now look at this mechanical injury. There is a mechanical injury which has significant length, insignificant width. What is this mechanical injury known as? I need some 3 or 4 points, 5 points. आपको 5-6 points बताना पड़ेगा. 5-6 points. What is this basically? Let's see who is going to answer. Take your own time. So this is a case of assault and death. During autopsy, during Shava Pariksha, the finding is some lines are there, and these lines are like this, okay, and lines showing some denuded epithelium at one end. So एक end में denuded epithelium है. So what is the importance of this? There are 5 points, and also let me know about the age of injury. So this is probably somewhat red in color. Try guys. So very important spotter, very commonly asked. So very good, many answered correctly. So this is basically scratch abrasion. Also known as linear abrasion, which has significant length, insignificant width. So color is red. So it is fresh. So commonly caused by the blunt object. Blunt object. And the presence of denuded epithelium will give you some idea about direction. Direction. Example, sexual assault. So medico-legally, abrasion is very important. Why? Because it is present at the site of injury. Like example, in case of sexual assault, it is normally present around the breast, around the mouth, around the face, around the genital area. So like example, abrasion over the labia majora, minora and the inner thigh, that is suggestive of rape. So this is important. So these are all important 5 points. Yeah. The first answer given by Medico as well. So Medico also, Srinivas also, Sanjana, Lokesh as well. Sanjana, Lokesh. So here, so 3 important toppers are Sony Sanjana, Medico, and also by Srinivas, and also by Priyanka, That's great. So that's great. Then the one more very important photograph commonly kept as a spotter in forensic medicine. The history is, this is the case of road traffic accident. There is a fracture of anterocranial fossa, the collection of blood in anterocranial fossa. What is this known as? And what type of bruise is this? So I need what is this basically. Identify. Second question, what type of bruise is this? Third point, color changes. What are normal color changes? What are normal color changes? 3 questions. 3 questions are there. Come on, try. You need to write the question number and the answer. All the 3 question and answer. Just listen to me, then you can answer. So instead of answering multiple comments, you just answer in one comment, everything in one comment, all the 3 questions. So question is, identify. आपको आइडेंटिफाई करना पड़ेगा और आपको बताना पड़ेगा what type of bruise is this, और आपको color changes basically, what are color changes in that. Try. So this is basically migratory bruise. Migratory bruise. This is known as raccoon eye. Raccoon eye. Also known as spectacle hematoma. So the collection of blood around the eye. So because the occipital frontalis muscle doesn't have anterior attachment, it has only the temporal attachment and the posterior attachment. So the blood collects in the most dependent part, that is around the eye, known as raccoon eye. So commonly associated with anterocranial fossa fracture. So anterocranial fossa fracture. So color changes. What are normal color changes in bruise? Let's see what are normal color changes in bruise. Good. So normally it starts with the red, then it become blue, then it become brown, then it become green. So then yellow. So the mnemonic is RBBGY. RBBGY. Yes. Okay, good. So the answer given by many. Swamirip Sarkar, very good. Swamirip Sarkar, SS. Smaranya Hati, our regular student. ESG. Maneka Datta, good. So Datta, it's great answer. So all of you write in the chat box. RBBGY. R for red because of the oxyhemoglobin. B for blue, deoxyhemoglobin. B for that is black, a brown color because of the hemosiderin. That is green, that is because of the hematoidin. Y because of the bilirubin. So this is classical color sequence present in natural bruise. It is absent in artificial bruise. It is very important in estimation of age since injury. Age estimation. RBBGY. Keep writing. Chaudhary, so Priyanka and others. Maneka Datta. Okay. This is okay. Then I have one more newspaper headlines here. So Smaranya Hatti, and listen, later you can tell me. Bhaskar Shetty. So this is a very famous case. So Bhaskar Shetty murder case in somewhere in Karnataka. So he was killed by his relatives. Basically, yes, it is given there, the wife and the son and the priest. So some property dispute was going on between these two parties, and he was millennial. And he was killed by his relative with the help of iron rod, that is iron rod assault over his head. Later, his body was chopped into multiple pieces, like head, upper limb, lower limb, into multiple pieces, and they were burnt in Homakunda. That is known as Homakunda murder case as well. And some pieces were thrown into the river or nearby a pond. So after a few days, the police complaint has been lodged by the mother of this victim, and later the police arrested all the relatives. They came to know this is the scenario. So my question is, what are two components of murder? What are two components of murder? What is the BNS section for that? So what is the BNS section for that? You need to tell me what are two components of any case of murder. Second thing, what is the BNS section or definition of murder, punishment for murder, attempt to murder. Like example, Homakunda murder case. Come on, try. Maneka Datta. Try yourself. What is murder? Try. Try, all of you guys. Try yourself. So like this, in this murder case, so they got multiple bone pieces, especially in the pond. After that, these bone pieces, basically the bone marrow, so it was matched with the mother's blood cells, basically by using DNA fingerprinting, and there was 100% match. So this case has been solved only on the basis of circumstantial evidence. Very interesting case. After the class, you can just type in the Google Homakunda murder case. Okay. Yes, come on guys, come on, try. Okay, the finally, so the answer given by, yeah, okay. The first to answer Priyanka. So Priyanka, very good. So murder is equal to mens rea and actus reus. Actus reus. Mens rea means guilty mind. Actus reus means guilty act. So in this case, it was pre-planned murder. There was proper planning. He was killed by assault, probably head injury due to the iron rod. Then body was chopped into multiple pieces. So it is showing that there is a planning, there is a guilty mind, and there is a guilty act. So it is pakka a case of murder. So this is punishable under 103 BNS. So all of you write Homakunda murder case is equal to Homakunda case is equal to 103 BNS. Write this in chat box. 103 BNS means murder. So in different way you can write Homakunda case is equal to 103 BNS. Keep writing. Keep writing this. Okay. So the answer given by Priyanka, very good, very good. Ruday? So one more good example for murder recently, that is Uttara murder case in Kerala. That is by using snake. Okay, again here husband is the killer, the victim is the wife. Okay, yes. Now very interesting. Now all of you look at this. This is very interesting scenario. So this is bathtub and bride in the bathtub. Very famous case. The brides in the bathtub. Very famous case of murder. That is a case of drowning. So my question is, what are 5 findings in drowning? What are 5 findings in case of drowning? One reference is brides, the murder of brides in the bathtub. Try 5 findings in drowning. Any 5 findings in drowning, in general drowning. I'm not asking you about this case. Any case of drowning, what are 5 important points? You need to write about the question number 4 and 5 findings in one sentence. Okay. So one is froth, many answered. Second, washroom and hand. Emphysema aquosum, better known as bogey lungs. Emphysema aquosum. Then cadaveric spasm. Cadaveric spasm. So the first to answer again by Muhammad. Muhammad, very good answer. Diatoms. So diatoms. Good answer. So first answer by Muhammad Ansari. Ansari, great. Then question number 5. So we discussed many times in previous classes, umbrella murder case. So my question is, what is the substance used in umbrella murder case? So 5 points again. 5 points. So what is the substance used in umbrella murder case? Okay. What is the mechanism of action? What is the fatal period? What is the fatal dosage? And MLI. So this is umbrella. So this is umbrella tip. This is the pellet which is found in the postmortem. So 5 points about this clinical scenario. Again, you need to write about the question number. Then you need to tell about what is that substance used. What is the mechanism of death? Fatal period क्या होगा और fatal dosage और MLI. Madhusudan is telling, sir, it is basically aconite. No, it is not aconite. It is not aconite. Yes, very good. So the first answer given by Dr. Chaudhary. So Chaudhary said, sir, it is resin. Resin. Castor. And he also mentioned that fatal period is 3 to 5 days. Fatal dosage 10 seeds. So it is used in murder. So what is the mechanism of action? It inhibits protein synthesis. So once resin enters the body, it inhibits RNA polymerase. It inhibits protein synthesis. When protein synthesis is affected, that leads to hemorrhages, cell death, especially brain hemorrhages, liver, kidney hemorrhages, and death. A person dies within 3 to 5 days. It mimics like natural death, like example stroke. So very famous case is umbrella murder case. The substance used was resin, that is commonly known as castor plant, also known as R&D plant. Good. So many answered, that's great. This is about question number 5. Then one more important spotter, very commonly asked in the exam. So look at this. So this is the finding during autopsy. Now you are in the autopsy room. So this is the case of road traffic accident. A 30-year-old male with a history of road traffic accident. On examination, so there are petechial hemorrhages. So they are petechial hemorrhages. There are some hemorrhages in the corpus callosum, midline structure. And on histopathology, there is one finding which is known as retraction ball. So retraction ball. Again, I'll repeat. A 30-year-old male died in a road traffic accident. During autopsy examination, petechial hemorrhages are found. On histopathology, retraction bones are found. So questions are, what is the diagnosis? What is the diagnosis? What is the prognosis? Good prognosis or bad prognosis? What is the investigation of choice? What is the investigation of choice in living person suffering from this condition? Try this. Again, this is very important. MCQ, very important. case in forensic medicine? Try. Yes, first to answer, Maneka Datta. Maneka Datta said, sir, it is very good. Excellent, Maneka. So this is diffuse axonal injury. Die. Prognosis is very bad. Investigation is MRI. MRI, it has poor prognosis. The common structures involved are midline structure like corpus callosum, or at the junction of white matter and gray matter. On histopathology, there will be retraction balls. So, very important question. MRI. So the first to answer by Maneka Datta. So Maneka Datta, very good. Excellent answer. Good. That's great. Ruday, good. So this completes your question number 6. Then guys, question number 7. Now listen to the history. So this is the case of unnatural death. Okay. This is a case of unnatural death. Unnatural death of a 20-year-old male. Sudden death. Sudden death. Suffering from some genetic condition. So the question is, what is the diagnosis? First you need to tell about the diagnosis, question number and diagnosis. What is the cause? What is most important clinical finding? Most important clinical finding. 3 questions are there. So try to answer. So on examination, there is a collection of blood in the base of the brain. It is between arachnoid matter and the pia matter. So it is not washable on pouring the water during autopsy. What is this diagnosis? What is the cause? What is the most important clinical finding in that? So age is 20 year, male, sudden death, some genetic condition. So good, try. So EDH, SAH, SDH, very commonly asked in the exam. This is one very important image-based question asked in our INA-CET as well. What we can see here, this is a classical case of SAH. Subarachnoid hemorrhage. Because of rupture of berry aneurysm. Berry aneurysm. Either due to trauma or spontaneous. The most important finding is the worst headache. The worst headache of life. The worst headache. The worstest headache of the life. So that is basically SAH. That become maximum in 1 or 2 minutes. So thunderclap headache. Yeah, thunderclap headache. Good. Let's see who has answered. Okay, very good. Srinivas is first to answer. Srinivas is first to answer. Then also by Priyanka. Then also by other students. You are very attentive. Great. I'll repeat again. This is SAH. Due to rupture of berry aneurysm, the investigation of choice can be CT scan and lumbar puncture, that is showing hemorrhage. And most important clinical finding is worst headache. and the cause is rupture of barrier aneurysm. Okay. Then the next question. Next question. This is the case of road traffic accident. So this is a case of car accident. He was basically a driver of the car. They were driving the car. He met with an accident. He found dead at the accident spot. So during autopsy examination, there is a finding like this. What is this finding known as? Like this face. Okay. So in case of road traffic accident, you will see multiple lacerations. So what is this known as? And what is the cause behind this? This is question number 8. MRI finding, so there will be diffuse involvement of the brain, diffuse involvement, and histopathology is be retraction ball. Yes, try guys. Yes, very good. So this is a case of sparrow foot mark. It is due to windshield glass injury. So it's a type of secondary injury. Okay. So many answered correctly. So whiplash injury also correct. Sanjana Lokesh, very good. SJ also very good. Sparrow foot mark, shattered tempered glass. So many answered. The first two answered by Ansari. Ansari, great. Then later by Menika Datta, Srinivas, Ruday, Medico, great. All answered. That's really nice. Sparrow foot mark. Then the question number 9. All of you listen here. Now you are in the Shava Pariksha room. You are in the autopsy room. A case of unknown poisoning. So a case of unknown poisoning. Unknown poisoning. On examination, the total stomach is hemorrhagic. Hemorrhagic. In crime scene, they found some white color compound. They found some white color compound which was colorless, tasteless, odorless. My question is, what is the finding in this particular case of autopsy where you can see hemorrhagic mucosa and a case of metallic irritant poisoning, a case of heavy metal poisoning? What is this case known as? Question number 9. Try this. So this is basically arsenic poison. And the finding is the red velvety stomach. So very simple question. So arsenic poison, red velvety stomach. So the answer given by many. Priyanka is first to answer. Priyanka, very good. First to answer, Priyanka. So great. So treatment is ball. Then the last question. So now this is one important question. Again, a case of unnatural death. And in Delhi. So probably in cold season in Delhi. So on examination, what we can see here. So sunken eyeballs. loss of subcutaneous fat, and on examination tuberculosis is present, and most of the organs undergoing atrophy. Okay, so atrophy is there. So gallbladder is distended. What is this finding? What is this finding known as? And what is this case? Yes, very good. Many answered correctly. So again by Muskan Maharaj. So this is a case of starvation. And all of you remember, in starvation, so what is important in starvation is, starvation can be acute starvation, chronic starvation. So the important finding in chronic starvation is loss of subcutaneous fat. Most of the organs they undergo atrophy, usually yellow atrophy, except the brain, except the gallbladder distended. Now question is, what is the fatal period of starvation? What is the fatal period of starvation? What is the fatal period? So acute starvation, so when water is not there, food is not there, the person going to die in 10 to 12 days. So no food, no water, the person going to die in 10 to 12 days. When there is no food, when only water is there, the person is going to die in 6 to 8 weeks. So two important questions. So all of you write in the chat box. No food, no water, 10 to 12 days. No food, only water, 6 to 8 weeks. Again, this is MCQ, commonly asked in forensic medicine. Keep writing this. 60 days, okay, no food, that's okay, 7 to 12 days. Muskan Maharaj, good, great. Keep writing this, Dr. Chaudhary and others. Okay, so this completes your today's class. I hope you enjoyed today's session. So this is about legal procedure. If you have any doubt, you can ask me. Yes, guys, if you have any doubt, you can ask me from this topic, basically legal procedure and medical law ethics, for next 5 minutes. Come on, guys. Try. If you have any doubt, feel free to ask. Okay. So Mohammed is telling, sir, bit hard question today. Yeah, some hard question today. Some unexpected, difficult question, moderate questions. Ruday? Very good. Smarana is asking, sir, dowry death after 7 years of marriage, why magistrate inquest not done? Why? See, as per the data, most of the dowry death cases, the dowry harassment, so that occur within 7 years of marriage. So 7 years is a long time. So after 7 years, probably not because of dowry, it can be some other natural causes or some other causes, not the dowry death. So in general, so that is actually by the law. So by the law, so by the lawmakers. So 7 years, within 7 years, that is dowry death. After 7 years, probably there will be a good understanding between husband and wife. There won't be any dowry harassment. There won't be any dowry demand. That is the probable reason. Okay, Mohammed Ansari, yes, basically, as NMC board is there, there's also other boards for the BMS and homeopathy practitioner as well. So, Salik Ahaj, what is skipping heartbeat? Okay. So, this is basically a forensic medicine class. So, I'll let you know. Okay, Parisultana, I'll let you know about this. Okay, guys. So I hope you understood today's topic. Okay. Yes, Srinivas, any doubt? Any doubt? Now I have a skeleton today. I have one more question today. Now look at this. Now it is visible clearly. So we have new member today. So I have a simple question for you. What is the best bone? So this is skeleton. Okay. What is the best bone for sex determination? Say hello. Hello, guys. What is the best bone for sex determination? So I'll ask you a simple question today. So say hi, hello to our friend, a new guest today. Okay. Yes, come on, guys. Good. Many answered correctly. So the best bone that is for determination of sex is the pelvis. That's okay. The question number 2, what is the best bone for diatom's estimation? For diatom aspiration, which is the best bone? Try. Yes, Sadiq. Try this. 2 questions. Second question. Again, look at the skeleton, try to memorize. Best bone for sex determination, you said pelvis. The best bone for diatoms is, your answer must be sternum, or it can be femur. So best is femur. The next best is, that is your sternum. The commonly done is sternum. So sternum, you can see the midline bone. So that is the common bone which we do aspiration in case of drowning. Second important question. Third important question. Okay. Now look at this humerus. So this humerus, the humerus length is 30 centimeter. So humerus you can see here. In a skeleton, the humerus length is 30 centimeter. What is the approximate height of the skeleton? So 30 centimeter is the length of the humerus. What is the probable height of the person? Try. So your answer should be, the length of the humerus should be multiplied by 5. So 30 multiplied by 5, that means it's around 150 centimeter. 150 centimeter. Okay. So 30, okay, around 1.5. So around 150 centimeter. Many answered. The first answer given by Muhammad Ansari is telling, sir, it is around 5.15, it's 150. That's great, that's great. One more question asked in the exam. Say example, burnt body. So example, skeleton is totally burnt, or advanced decomposition. In advanced decomposition, what is the best bone for DNA fingerprinting? Advanced decomposition. What is the best bone? Venkatesh. Yes, very good. So it is basically teeth, or we can say enamel. The best is the enamel. Enamel. Good. Enamel, teeth. So many they answered. That's great. Now I am showing you one more torture method here. What is this torture method known as? So torture method, the placing plastic cover around the face, around the mouth and nostril, leading to death due to suffocation. What is this torture method known as? Look at this torture method. Look at this. One more very important question. Placing plastic cover, covering the head and neck, leading to suffocation and death. So this is known as a dry submarine. Dry submarine. Okay. Dry submarine. Now, I have one more interesting scenario. So now look at this brownie. So we have brownie here. All of you say hi to our brownie. So brownie is back today. So this brownie is there now. He's having sexual perversion. He's having sexual paraphilia. And this brownie is having sexual gratification with the dead bodies, or sometimes with smell of dead body. So smell of dead body, or by looking at the dead body, he gets sexual gratification. What is this known as? And is this punishable or not? And what is the BNS section for that? Very interesting question. Very interesting question. Srinivas, Maranya. Yes, come on guys. So this is known as necrophilia. Necrophilia. It is punishable under 301 BNS. So please write in the chat box to complete today's session. Necrophilia is equal to 301 BNS. So that's completes your today's class. And do 97 previously, that is okay, Ruday. Now it is 301. So that completes today's session. So thank you all. Thanks for all. So thanks for interaction. Thanks for your great attentiveness in the class. So we'll come up with some more stories. We'll come up with some more sparters, some more interactive session. So in upcoming days. Thank you all. Bye bye.